So now moving on to case study B, where we look at different COVID-19 vaccines. So in this case study, a 35-year-old man arrives at your pharmacy and reports to you that he is unvaccinated for COVID-19. He has avoided being vaccinated because he doesn't want harmful chemicals in his body. Due to changes in his personal life, he's dating someone new. He has been convinced to get vaccinated. He would like to know his options and asks if you can explain the differences in various types of COVID-19 vaccines available. You have decided to inform this individual of 3 vaccines that are provided in Canada: the Pfizer-BioNTech mRNA Comirnaty, the Medicago Covifenz, and the Novavaxoid. Compare the mechanisms of action and efficacy data for these vaccines. So for the Comirnaty Pfizer-BioNTech mRNA vaccine, generic name is actually BNT162b2, and it is comprised of a nucleoside modified mRNA, including the full-length SARS-CoV-2 spike protein that is encapsulated in a lipid nanoparticle. The lipid nanoparticle protects the non-replicating mRNA from degradation and allows it to be delivered into host cells after intramuscular injection. The primary series is often taken in 2 doses at least 21 days apart. So here's the mechanism for how Comirnaty vaccine works. So first, from the SARS-CoV-2 virus, the mRNA, including the spike protein of the virus, is isolated and included in a lipid nanoparticle like this. The lipid nanoparticle is injected intramuscularly into the human body, and once attached to the host cells, it inserts mRNA into the cytoplasm, and particularly not in the nucleus, in such a way as to reach the ribosomes and use them for synthesizing the viral spike proteins. This process is called translation. And proteins then achieve the cellular membrane and attract the antibodies against the viral spike proteins and the cells of the immune system, particularly the T helper cells, which produces cytokines. And the interleukins also stimulates the T cells to proliferate the memory T cells that will help fight future infections by this virus. So this study, published in the New England Journal of Medicine, investigates the safety and efficacy of the Comirnaty mRNA COVID-19 vaccine. In an ongoing multinational placebo-controlled observer-blinded pivotal efficacy trial, researchers randomly assigned about 43,000 persons 16 years of age or older in a 1-to-1 ratio to receive 2 doses 21 days apart of either placebo or the Comirnaty vaccine candidates at 30 micrograms per dose. The outcomes of interest is the primary endpoints were efficacy of the vaccine against laboratory confirmed COVID-19, as well as safety. So in terms of efficacy, among participants with and those without evidence of prior SARS-CoV-2 infection, 9 cases of COVID-19 at least 7 days after the second dose were observed among vaccine recipients, and 169 among placebo recipients, corresponding to 94.6% vaccine efficacy. Between the first dose and the second dose, 39 cases in the Comirnaty group and the 82 cases in the placebo group were observed, resulting in a vaccine efficacy of 52% during the interval between the first and second dose, indicating that there is early protection by the vaccine starting as soon as 12 days after the first dose. And supplemental analysis also indicated that vaccine efficacy among subgroups defined by age, sex, race, ethnicity, obesity, and presence of coexisting conditions was generally consistent with that observed in the overall population. In terms of safety, vaccine recipients had a higher incidence of local reactions such as pain, erythema, swelling, and also systemic reactions such as headache, fatigue, myalgia at higher rates than placebo, with more reactions with the second dose. And most reactions were either mild to moderate, and it resolved rapidly. So the researchers concluded that 2 doses of mRNA-based vaccine were safe over a median of 2 months and provided 95% protection against symptomatic COVID-19 in persons 16 years of age or older. There are also non-mRNA vaccines that are currently available against COVID-19. One of them is Novavax, which is made in the US. Novavax is a protein-based vaccine, this is actually a more traditional vaccine in the sense that it is synthesized in the same way a lot of existing vaccines, such as HPV vaccine is. Briefly, the mechanism for this vaccine is that mRNA for the spike protein is isolated and converted to DNA using reverse transcriptase, and this DNA is inserted into baculovirus, which are viruses that infect insects in particular and do not infect mammals. Baculovirus containing the spike protein DNA are injected into a culture of moth cells, which translates spike protein DNA into spike proteins. And the spike proteins are then isolated and collected from the cultures and assembled onto nanoparticles. Matrix adjuvant is included in the mixture of spike protein nanoparticles to stimulate cellular and humoral immune response to vaccines. And this mixture is then injected into the individual in 2 doses. Another protein-based vaccine for COVID-19 is Medicago, and which is manufactured in Canada, specifically Quebec and Italy. In brief, we have a similar process. Instead of insect cultures, the spike protein is inserted into a cousin of the tobacco plant, and it generates spike proteins and wraps it in a virus-like particles. We also include GSK adjuvant in the mixture to boost immune response, and this mixture is injected into the individual in 2 doses. So this technology is pretty unique because no plant-based vaccine has entered the commercial level till now. So we will go through the mechanisms for these 2 non-mRNA vaccines in more details in the following slides. So let's take a look at Novavax more closely. It is a protein-based vaccine that was authorized in Canada on September 17, 2022. As mentioned, it contains a spike protein that is on the surface of SARS-CoV-2 and also matrix M, an adjuvant, which creates a stronger immune response. It is indicated for individuals 18 years old and older as a primary series. And the Canadian National Advisory Committee on Immunization advises that the Novavax is not to be authorized as a booster, but may be offered if the individual is unable or unwilling to receive an mRNA vaccine. So as mentioned in the previous slide, isolated protein DNA is inserted into a viral vector that infects insects, and this viral vector carrying the spike protein DNA is inserted into a moth cell culture, and that results in a production of COVID-19 virus spike proteins that can be extracted and purified. The purified spike proteins are attached to nanoparticles and is combined with matrix M adjuvant that boosts the immune response, and this formulation is injected into the individual in 2 doses. And this protein-based virus creates an immune response where the spike proteins are recognized by the immune system, which produces specific antibodies against the COVID-19 virus. And if the vaccinated individual, is infected with COVID-19 virus in the future, antibodies will bind to the virus and stop it from replicating. So this study investigates the efficacy and safety of Novavax vaccine, which was a phase 3 randomized, observer-blinded, placebo-controlled trial conducted at 33 sites in the United Kingdom. Researchers assigned about 15,000 adults between the ages of 18 and 84 years in a 1-to-1 ratio to receive 2 intramuscular 5 microgram doses of Novavax or placebo administered 21 days apart. The participants who were seronegative at baseline were followed for safety and development of virologically confirmed symptomatic COVID-19 with onset more than or equal to 7 days after the second dose during a median follow-up period of 3 months. So in terms of efficacy, the incidence of COVID-19 was lower among vaccine recipients, and only 5 cases of severe COVID-19 occurred, and all of them in the placebo group. Vaccine efficacy was 89.7% overall and 86.3% against the alpha variant and 96.4% against the non-alpha variant in post hoc analysis. These trials were conducted before the emergence of Delta and Omicron variants. So for safety, vaccine recipients had higher incidence of local reactions, such as injection site tenderness or pain, and also systemic reactions such as headache, fatigue, myalgia, at higher rates than placebo. However, these were resolved pretty quickly. So in conclusion, a 2-dose regimen of Novavax was safe and provided 90% efficacy against symptomatic COVID-19. And frequency of adverse events were 0.5% in both vaccine and placebo recipients. So moving on to Medicago, which is the second protein-based non-mRNA vaccine that was authorized in Canada on February 24, 2022. The virus-like particles, or VLP, mimics the natural structure of virus and allows the immune system to recognize and generate an immune response. This vaccine is indicated for individuals 18 to 64 years of age as a primary series, and the NACI advised that it is not currently authorized or recommended as a booster dose. So the mechanism of action of Medicago is similar to Novavax, in that instead of an insect viral vector, the spike protein DNA is carried by a soil bacterium, Agrobacterium, which is the plant culture is then injected with this bacterium, and the target spike protein is integrated within the plant genome, and there is expression and assembly of new virus-like particles displaying the spike protein. And these VLPs can be extracted and purified. Once purified, the VLP vaccine expressing the SARS-CoV-2 protein, when administered by intramuscular injection, successfully produces the anti-spike protein antibody in host cells. So if the host is infected with SARS-CoV-2 in the future, vaccinated individuals are protected from SARS-CoV-2 infection due to the presence of neutralizing antibodies. So you can find the info sheet for Medicago at this site. So the phase 3 study was an event-driven, randomized, observer-blinded, placebo-controlled study conducted in North America, South America, and Great Britain in participants 18 years of age and older. A total of about 24,000 participants were randomized equally to receive 2 doses of Covafenz or placebo separated by 21 days. The primary endpoint was defined as occurrence of laboratory-confirmed symptomatic SARS-CoV-2 infection that is more than 7 days post-second vaccination. Participants continued to be followed for a period of 12 months after the last vaccination to evaluate the durability of the immune response and safety. So for efficacy, what the study found was that there are 39 cases confirmed in the vaccine group and 118 cases confirmed in the placebo group. Based on these cases, vaccine efficacy was estimated to be 71%. Table 4 presents diversity of variants that were identified during the phase 3 study. The dominant variant during the study's trial was Delta, and this trial was conducted before the emergence of the Omicron variant. So we don't know how it will be against this, particularly the Omicron variant. In terms of safety, solicited local and systemic adverse reactions were reported more frequently among participants in the Covafenz group than in the placebo group. The most reported solicited local and systemic adverse reactions in adults 18 to 64 years after receiving the first and/or second vaccination were pain at the injection site, headache, muscle aches, fatigue, and feeling of general discomfort. In adults 18 to 64 years, adverse reactions after vaccination were also usually mild or moderate of intensity and are resolved within a few days, 1 to 3 days. So this is a summary of the vaccine characteristics compared between Novavax and Medicago. So the National Advisory Committee on Immunization strongly recommends that a complete series with an mRNA COVID-19 vaccine should be offered to individuals in the authorized age group without contraindication to the vaccine. Some individuals cited COVID-19 vaccines safety concerns and therefore are hesitant to receive mRNA or viral vector vaccines. Therefore, the NACI recommends that an authorized recombinant protein subunit COVID-19 vaccine, such as Novavax or Medicago, may be offered to individuals who are not willing to receive the mRNA COVID-19 vaccine. So going back to our case study, based on the current recommendations, the patient should first be offered an mRNA COVID-19 vaccine, such as the Pfizer Comirnaty, or if the patient has an aversion to mRNA COVID-19 vaccines, then either Novavax or Medicago can be offered.